Okay, today's date is May
26th.
26th. Thank you. And we're sitting in the office with Tim Warren. Tim, tell us what you came to see us for and your age.
I'm 53 years old, and I came here because I was having intermittent but severe headaches, accompanied with spaciness, disorientation, and inability to really track conversations. And I had been to my regular doctor multiple times, had every test that they could possibly think of, and they said, you're in pretty good health. We don't know what's wrong with you. But I knew something was wrong. I felt terrible.
Did they try drugs on you?
Oh yeah, they said that they said, well, you probably need some antidepressants. That only made things worse.
Thank you. And how long have you been with us?
It's really only been about 9 weeks. I'm coming once a week, and um, it's flown by fast, and it's been great because I'm feeling wonderful.
Um, let's go through some symptoms.
Okay.
On a scale of 10, with 10 being the worst and 0 being perfection, except for energy. Let's start with energy. 10 is perfect energy, 0 is what you walked in the door with.
hmm
What number do you give me for energy?
I would say that my energy has come up to 70%, and it was a lot lower.
Okay, thank you. Headaches.
Headaches. I came in probably at about a two or three being bad. Now I'm up to eight, almost nine. That I hardly ever getting headaches anymore.
Thanks. Generally, with pain, I go from the upper number
Okay,
down.
okay.
So if you came in with 8 to 10, you're now down to 2. Is that
Yes,
what you're
that
saying?
is correct.
Okay. Sugar cravings.
Way down. I used to crave sugar all the time, and it's practically non-existent.
And your mood.
Much better. Not only and I feel motivated and more energized.
On a scale of 10, with 0 being crummy mood and 10 being perfect mood, what do you give us?
I'm a good solid 8.5.
Oh, I love it. That's great. You mentioned something about hope as well.
Well, one of the things it's kind of you can't really quantify this. I've done a lot of blood work and this and that, and there's numeric quantification. Um, but before I came in to see Robert, when the doctor said, "Hey, we can't find anything wrong with you," and I was feeling like crap, I was losing hope. I wasn't sure what to do, and so not only did I feel better, but having these guys as part of my health success team has just given me renewed hope. And now my wife's coming in, and I'm excited, and I'm telling people who've known me for a while, what a great experience I'm having.
Thank you. What about your sinuses?
I had had multiple. I had had severe chronic sinusitis, both as I've been supposedly diagnosed previously, sinus surgery, and it only got worse after that. And ironically, how mysteriously, I ended up with E. coli in my sinuses after my surgery. So they've been a problem, and now they're 90% better too.
What made the difference?
Well, I'm doing ozone therapy
Once a week.
once a week. I'm following a supplement program that you recommended, and I've been inspired to change my diet, going primarily vegetarian, and my sugar cravings are down, my carb cravings are down, and I'm losing weight. I've lost 10 pounds.
Incredible. And are you eating more living or raw foods?
Absolutely, and enjoying the heck out of it.
And,
It's fun. It's a whole different way of getting to cook. I like to cook, so I get to discover this whole new eating adventure.
outstanding. What part do you think the ozone has played?
Well, it's been the foundation of our treatment programs, and um, it's had to be a major part. I don't really know, but all I can say is I feel a lot better.
And you wouldn't want to let go of it, I take it.
Absolutely not. And
Okay.
I'd recommend this to anybody.
Thank you very much. Is there anything else you'd like to say to the viewer?
Um, you know, you're dealing with a a friendly, supportive team here of experts that are really personalizing the treatment for me. They're fun to work with. I'm excited about coming here, and this has been one of the best investments I've ever made in my life.
Thank you very much.
You're welcome.
Tim, one other thing. Do I have your permission to use this any way I please?
Absolutely. I'm thrilled to share my opinions and my experience, and hopes that people will watch this, learn, and take action, because it's worth it.
That includes posting it on the internet, correct?
Big time. Put it all over the place.
Thank you very much. Well, now we're with Sabrina Brahm. This is Tim's wife. And Sabrina asked me to get her on the video as well to tell what she's noticed with Tim from her perspective.
I came in with Tim the first time he came, which was about 9 weeks ago, and his skin color was gray and pasty. He was having trouble thinking and couldn't focus on things very well. Plus, he was having bad headaches. He saw Dr. Rowan. He had one treatment, and then after that treatment, we went home, and I looked over at him, and his skin was pink and vibrant, and he looked healthy for the first time in probably a couple of years. The next week when he came back, his body skin had been kind of mottled. It was like white and pink, kind of blotchy, like somebody was pushing on it. And when he came back the second week, his skin color on his body was normal, pink, healthy looking. And after 4 weeks, his headaches had gone away, his spaciness had gone away, he was excited about things. All of a sudden he was excited about his job and what he was doing, and I hadn't seen that happen in a couple of years. And the other doctors had said he needed antidepressants. And funny this, when we changed his diet and did the things Dr. Rowan said to do, that depression, that lethargy just went away. So I'm very excited about that.
Thank you. And what that tells me, and we find that in most people, they don't need antidepressants. What they need are things that make their neurons work the way God designed them to work. In other words, get out the toxins and poisons that are irritating them, and get the nutrients in them that they need to start making energy. When you make energy, then they have the energy to work.
Right.
And the depression clears.
Right. So the regular doctor had done a blood test, and they said there's nothing wrong with you, Tim, so you just need antidepressants.
You ready for antidepressants, Tim?
No way. No way.
Thanks, my friend.
Sure.
And Sabrina, do I have your permission to post this on the internet?
Absolutely. Any person that does what you say, I know they're going to feel better, and I'm excited about that for anyone.
Thank you. Why are you here today?
I'm here because I'm going to find out what Dr. Rowan can do for me. I'm
Okay.
excited about that.
This is your first day, right?
This is my first time.
Okay, thanks.
Thanks.